So the next one we're going to do, you're going to get on your hands and knees, like this, okay? If you have knee problems, you can put a pillow underneath your knees. If you have arm and shoulder problems, you can also put a pillow underneath here if it will help, okay? You can see how Tara, when she's on her hands and knees, she has this nice posture. She has a little bit of an arch here, a little bit of hump up here in her upper back, and then her neck remains straight, okay? She's not going to look up, and she's not just going to let that head dangle down, okay? She's going to keep it right in line with her spine so that everything's nice and good, okay? The first exercise we're going to do, Tara's going to suck her belly button up towards her back and then up towards her ribs, making her belly nice and tight. You can see when Tara did that, her back didn't change position at all. She kept everything nice in line, and now she has this nice and tight. She's going to hold that for 15 to 30 seconds. Once again, making sure she can breathe and talk. So Tara, can you talk to me?
Yes.
Good, so she can talk and breathe, okay? And she's going to do this 15 times once a day, okay? Okay. The next exercise, go ahead and relax, Tara. We're going to be in this position again, making sure we keep good posture here in the back, the head in line with the body. She's going to tighten that belly up by sucking that belly button up both ways. Good. And all she's going to do is she's going to raise one arm up. Good. Back down, and then the other arm up. Good. Keep going there for me, Tara. You can see here in her back, she's not rolling her back at all. She's keeping it nice and in line, nice and flat. If I put a plate of food up here in her back, it wouldn't fall. Okay? She's going to do this 30 times per arm once a day. The next one, same thing. She's going to tighten this belly again. Hold that nice and tight, keeping good posture here. She's going to raise one leg up behind her. Good. And back down. And then she's going to go the other leg. Good. She's keeping the belly tight the whole time. Keep going for me here, Tara. You see how she's moving back and forth a little bit? Down here, that's all right, because this is a lot more difficult. It's harder to keep that back flat. As long as she has her belly tight, we're okay. Okay, good. Nice. Okay, the next one, a little bit more difficult. She's going to tighten this belly again. Good, you see how her back has good posture. That's more important in this one, okay? Now she's going to raise her right leg and her left arm up at the same time. Good, just like that, and then back down. Good, this belly's staying tight, and she's going to the other two. Good. Perfect. Good. Just like that. Perfect posture. She's doing a great job. One more there for us, Tara. Good, and relax, okay? Those last two, she's going to do 30 times per side, once a day. All right, so the next one we're going to do, Tara's going to lay down here like she is, stretched out, like she's a superhero. She's going to roll up a towel or double a pillow, put it underneath her forehead, so her neck stays in line with her body again. All right? Once again, she's going to suck in that belly, make a nice strong contraction in front of her belly there, okay? And all she's going to do, she's going to lift this arm and this leg up off the table at the same time. Good. Back down. And then she's going to come to these two. Good. Keep going here for me, Tara. You can see her back's not really changing. She gets a little bit of an arch. That's perfectly fine because this is the muscles we're working right now. Her belly's remaining tight during this whole thing. Okay? Good. She's going to do this 30 times per side once a day. Now, with all these exercises, I said 30 times or 15 times. Whatever I said, that's your end goal. As you get stronger, you'll be able to work your way up. But if you need to start with a set of 5, a set of 10, whatever that is for you, you do that. And then eventually, as you get stronger, you'll work your way up and be able to do 30. Go ahead and relax there.
This is a hamstring stretch that we're going to do standing. So all you need is some kind of elevated object, such as a chair. So I'm going to have Amanda put her leg up, toes straight. Good. And you're just going to keep your back straight, but you're going to bend over your toe until you feel stretched. Now you're going to hold this for 30 seconds. We're going to do this 5 times, and then we'd like to see you do it between 2 to 3 times during the day.
This exercise is a hamstring stretch for those people that typically have low back pain. Okay, we're going to lay supine or flat on your back. Amanda's going to bring her hip to 90 degrees. Lock your hands in behind your knee. Okay, goal is this body part is 90 at the hips and 90 at the knee. Okay, Amanda, you're going to hold right there. And you're going to bring this leg up. You're going to feel a nice stretch. You can see she's shaking a little bit. She's going to hold that for 30 seconds. Okay, we're going to repeat that 5 times. And our goal is to do that 3 times a day. Okay, some common things that happen here is as she straightens that leg up, what happens is people want to let your leg down. Do not let that down. So you lock your hands nice and tight. Again, keep 90 at least at the knee and hip. Okay, stretch. You're going to feel a little bit of a burn behind here. Okay, and again, the goal is hold for 30 seconds. Repeat 3 times. Repeat 5 times, and you're going to do it 3 times a day.
What we're going to do is we're going to stretch some deep muscles in her bottom there that tend to cause some issues with our low back, all right? So Tera's just going to lay here nice and relaxed. She's going to bring this knee up to her chest. Good. What she's going to do, she's going to grab with the opposite hand. She's going to bring this knee across towards me and up towards that opposite shoulder. Okay, she's pushing down on the knee and applying a little pressure down towards her bottom at the same time. So it looks something like this if she could actually move. Okay, she feels a nice strong stretch back in this area. All right, you should feel that. You want it to be comfortable, but we don't want you to not feel much. We want you to be feeling a little stretch, so make sure you're not pushing too hard. All right, so find that happy medium. She's going to hold this for 30 seconds at a time, and she's going to do it 4 times, twice a day. Do the same thing, grabbing with that opposite hand, pushing down towards the table and down along the long shaft of her bone here to feel a nice strong stretch here. Same thing, 4 times, holding for 30 seconds, twice a day.
This stretch is going to stretch out your piriformis, your hip abductors, and what we're going to do is have Amanda, you're just going to lay down. Okay, you're going to have your legs straight, and what I want you to do is to bring her right ankle to come over on her left knee. Okay, now, if you can feel a stretch here, hold for 30 seconds. If you can't, start to progress your knee up higher and higher until you can feel a tight stretch. Now, if you can't feel a stretch here, what I'm going to have Amanda do, I'm going to have Amanda grab through her legs and have her pull back to 90 degrees, and she's going to pull and she's going to push the opposite knee. Now, keep it at 90. Good. I want you to hold these for 30 seconds. We're going to do this 5 times and 3 times a day, 2 to 3 times a day.
All right, the next one we're going to do here is a little different. You need a door, you need your band that we gave you, and a chair, okay? First thing you're going to do is you're going to open the door, put the band in right around the doorknob here, okay? Make sure you have a knot tied in it, and make sure it's not in the way of this latch right here, because if it is, the door could come flying open on you. Now all you're going to do is you're going to shut the door, you're going to test the band to make sure it's working. It's not going to come out. Okay, the next thing, you're going to take a chair. You're going to set it at an angle away from the door. All right? I'm going to have Tera sit down. She's going to sit in it like she would any chair. Good. She's going to have good posture. See how she's sitting up nice and straight. She's not got a flat back. She has a little bit of an arch there. Okay? And all we're going to do is give Tera this band here. Go underneath the arm here, Tera. There we go. Good. She's got some tension in the band right now. Okay? So already starting out, she has some tension. But what we're going to do, she's going to tighten that belly again. She's going to suck it in, hold it nice and tight. Then she's going to start pre-turn, just like that, okay? She has her belly nice and tight. Now she's just going to rotate as far as she can. Good. And she's in control the whole time. She's not letting the band pull her anywhere. She's pulling on the band, okay? Good job, Tera. Just like that. Good. Go ahead and relax. Then all you're going to do, have you stand up here, Tera. We're going to do the exact same thing, but now we're going to do it towards the opposite side. So you just have to change the angle of the chair. Tera's going to sit back down here. Good. She's going to put the band back in her arms, how she had it there. Good. Belly's nice and tight. She's sitting up nice and straight. She's going to start rotating to this side a little bit, and then all she's going to do is turn just like that. Good. Do a couple more there for us, Tera. Good. You're going to do this one 30 times to both sides once a day. And this is another one of those exercises that you're going to have to start out maybe with 5 or 10 at a time, but then build up as you go, okay?
So this stretch is going to be the hip flexor stretch. What we're going to have Amanda do is laying flat. Ideally what you'd like to have is your knees dangling, but you could also do this laying on the ground. But most importantly, keeping your pelvis or your lower back on as flat as you can on the back of the table or the ground. Okay, so what I'm going to have Amanda do is I'm going to have Amanda bring her right leg up. Now she's going to grab, and she wants to just leave this, the lower part of her leg dangling, and then just pull back until you feel a stretch in your hip flexor. You're going to hold this for 30 seconds. You're going to do this 5 times, and we'd like to see you do this 2 to 3 times a day.
So just remember, with all the exercises that we just learned, start where you need to be. You know, I said 30 or 15 or whatever I said to start with, but start at your level. So if you need to start with 5 or 10, whatever that is, you start there and build up as we go, okay? Low back pain affects a lot of people, and it's a big issue. And if any time through this you start to get a lot of pain or some sharp pain or anything out of the ordinary, you know, obviously you need to check with your physician, or if you're currently seeing a physical therapist, you need to check with them and just tell them what's going on. Don't just stop doing the things that are bothering you, and get in contact with somebody to make sure that what you're doing is right and it's the right form and right for your specific situation. Thank you very much.